Yes, now we are looking your pre-operative video. Before the procedure, I made the physical examination and find nothing. And when I do Doppler ultrasonography, as we see here, we find these great vessels. This is my finger actually, and yes, these vessels are large. I usually measure the diameter of these vessels. If it is bigger than 3 millimeters, it's varicocele. Now I am measuring and you are recording, you are using this, and you show it, it's 3.9. And you were not diagnosed with other doctors, true?
Yes.
Yeah, they said there is nothing. And when I first examined, I didn't find. This is subclinic varicocele. We call this subclinic varicocele. Nothing in the physical examination, but in Doppler, really big veins. So, yes, it was obvious. We are convinced with the procedure and you accepted the procedure. And this is Doppler. Even without straining, just normal breathing, you were having this reflex. So we decided to go to the procedure. Now I will try to find, without showing your name, yeah, in the procedure what we see. Look, this was a big vessel in the procedure. Normally, we dissect this vein. In classic varicocele procedure, it is recommended in all over the world, Germany, United States, England, everywhere, ligate it from here and leave this for self-disappearance. But when I ligate it, it will fill with blood and you will have more pain after the procedure. Your symptoms will disappear 3 months, 6 months after the procedure. But we don't ligate it here and leave it behind. What we do, we dissect it and take this vein out completely in the procedure. We don't wait it for self-disappearing. So this is what we do in the procedure, taking the vein out completely. This is 25 centimeters of external spermatic vein. This is outside of the spermatic cord. And there is inner parts. This is what we, and yeah, in the operation we thumbs up. And this is the inner veins. There are also inside inner veins. You can ligate it here and leave it behind, self-disappearance. No. These are the steps of Istanbul varicocelectomy technique. And I showed you how was it with Doppler. They are all disappeared now. You say your pain is better. Your pain is disappeared, and yeah, and it is in only 2 or 3 days after the procedure.
Just as you said, you mentioned before the examination that with some people it could take longer, but with me, after the second day, I felt great. I could go work or do something else.
Yeah, people ask me from abroad, from other countries, at what day can I turn back to my country, fly back to my country? What's your recommendation?
So today is my third day here after the examination, after the procedure, and I will return today. So I think most people could do that too.
Yeah. So it's really different from patient to patient, but they can return. It may be difficult for some of them. For you, it seems very easy, but some of them maybe they will need more painkillers. Maybe they will have more pain for a few days at home, but it's possible to come from another country, have the procedure here, turn back to their country. Yeah, that's what we do different, and it really works. Why other doctors do not think about this? I am specialized in varicocele operation. It is a very simple operation in urology practice. Nobody cares about it too much. Every urologist is working in cancer cases, dialysis, kidney stones, very difficult diseases, and they are little diseases, mortal diseases. Varicocele is very simple for them, and they don't work on it too much. But this is my hobby.
That's the problem why the doctors I went before did not seem to care that much. They shrugged it off, said it's a varicocele.
It's very simple, they say.
It's a simple thing. Yeah. Not worry, nothing will happen. But
I love it. It's my hobby. I am working on it. And what I see is total success rate of varicocele operation is 70% in all over the world, and for pain, for your pain, the success rate is 50%. So in my procedure, I don't want to say 100%. It is not scientific, but really very, very high. And at the first days of the operation, after the first day, the pain has gone. Yeah, it's very successful in this. Okay, thank you very much for coming to us, having our procedure here, and giving this nice talk. It will be an example for others. Thank you very much.